Hello, hello. Let me pin the comment of what we are doing tonight. There we go. Hello. Hi. How are you all doing? Dr. Menopause, Carol, waving. Nice to see you all. We are back again with our third episode of Midweek Menopause Madness, the madness that ensues with this new phase of our lives, ladies. I have to say that, my gosh, thank you so much for all your messages. Honestly, I just feel like this is such an important subject that we need to be talking about together. I'm going to put my glasses on today so I can read some of your comments. Now, for those of you who are watching this on catch up, because I will post this on my main feed so that you can go back to it for reference, and so I can go back to it for reference, because we're going to be joined by Dr. Menopause Care Naomi Potter again. And I just feel like by all of us talking about this subject, it's becoming less taboo, and we are finding the knowledge and the power to make these educated decisions and choices about how we want to go into the menopause. So many of your messages. Today we're going to be talking about HRT, about hormone replacement therapy, and what the options are. Specifically, we're going to talk about estrogen, and progesterone. So we won't tackle testosterone today because it is a episode all of its own. So let's get Dr. Naomi on. The Midweek Menopause Madness conversation started. There she is. Good evening.
Hello.
Hello, my love. I
Hi.
might just turn, I'm really good. You know what? I'm just going to turn them off for a second so that I can see you properly, because sometimes the comments affect the reception as well. And we will turn the comments back on, and we will hopefully get to cover some of your questions. But thank you for joining us again, Naomi.
Thank you for having me. Thank you for having me. It's a pleasure.
You're really helping us all so much with your amazing knowledge, and
I hope so. I hope so. It's great.
Yeah.
I mean, it's a real privilege. I think it's brilliant.
We're really lucky to have you. I just wanted to read out, I mean, obviously, if you're just joining us for the first time this evening, in our previous two episodes, we covered the symptoms of menopause in the first one, and a little bit last week as well, didn't we?
I think we did.
You're losing track of time because you're very busy throughout the week doing lots of these talks on lots of other people's channels. You're cheating on me with a million different people.
I'm not sure I've done one this week, have I? I can't even remember, Lisa. I don't know.
Are you having meno brain? Are you having a meno brain?
You're the only one.
I've heard that before.
I promise.
But the reason, well, I wanted to read out this message that honestly, it's going to be hard to read it because it's massively emotional. I'm not going to give any names out of anybody who sent messages to our DMs at all, but this is one that I just thought was really important to read because it's kind of what a lot of us have had to deal with. So this particular lady said, and this came in after our first live, she said, "Are you right there?
I'm just going to Peanuts hit back, and he's just wanting to come in, so I'm just letting him come in next to us."
Peanut's the doggy, just in case everybody wants to know. Can we see Peanut? Can we have a little look at Peanut? Is Peanut safe? He's back from the vets, right?
Yeah, he's just had his leg operation.
Well, he's walking.
He is, yeah. He's just had his cruciate ligament fixed, so he's a bit grumpy. But
well, his tail's wagging. He looks in good spirits to me.
Yeah. There we go. Peanut, come here.
He can come up. Let's have him on your lap. It'll be really cute. We'll have like a little,
come here,
little Peanut action.
Maybe we'll have to, yeah, let's bring him up.
Yeah, give him some cuddles. No, it's fine.
There we go.
Oh, Peanut. He's so cute. Little darling. That's what he wants. He wants to be on his mum.
Yeah.
Sorry. So back to the menopause.
Back to the menopause.
So this was from a lady, and she said, I'm watching your menopause madness and I cried my eyes out through most of it. Finally, someone knows what I'm going through and feeling. Everything you both spoke about was everything I'm going through. I'm only 42 and this all started about 2 months after I turned 40. Sadness kicked in massively along with anxiety. I kept thinking why am I so sad? And why am I here? Would anyone miss me? These feelings are awful. And then came every other symptom. It was like a bomb went off inside me. Fatigue, weight gain, anxiety, body skin changes, hair loss, anger, irritable, massive lack of libido, vaginal dryness, insomnia, fatigue, mild urine infections, itching, depression, forgetfulness, brain fog. The list goes on. Went to the doctors about a month into feeling sad. I had bloods done. They came back fine. They told me to look into sex therapy, take some vitamins, D, B12, and get some hair loss vitamins. I mean, she's poured her heart out there, and honestly, like, they're all the symptoms that we discussed in the last 2 weeks, and it's like she had everything going. I mean, I just can't believe that that's the kind of reaction you get when you go to the doctor and you literally open your heart out. Obviously not all GPs, but I mean, that is a shitload of stuff to be going through and suffering alone.
It really is, and it's just a classic example of how doctors just don't know. They just don't know, and they don't know that those are all the classic symptoms that need treating, and that if they don't get treated, if women like that don't get treated, they lose some of the best years of their lives. And I suppose as medics, we kind of used to taking history, doing examinations, and then sending off for investigations. And if those investigations come back as normal, then we don't necessarily act on them. But it's in exactly that situation where bloods can easily come back normal, but women like that need treatment, and treatment can be completely life transforming. So I would encourage that lady to go and find another doctor, go back to another GP in her surgery, because help is out there. And yes, it can take a little bit of tweaking and a bit of adjusting, but there is an excellent chance that she can get back to feeling herself again.
So ring the surgery and just ask if there's anybody there, so maybe even a new doctor, a younger doctor who's had a little bit more updated training in that area. And then maybe there's a menopause specialist GP in the area or something, but just definitely go back to get some help, because I mean, from my experience, because we're going to talk hormone replacement therapy today, which is definitely what that lady needs. She needs help, guidance, whether it's down the natural route, whether it is the hormone replacement HRT, but definitely some guidance and some help, and somebody to listen to her and understand what she's going through, rather than just be fobbed off and say, go and take some vitamin B12 and some vitamin D. She's really contemplating life in that bloody message, and that's not just something that can be fobbed off just with a bit of a multivitamin.
No, and by all means, if you are deficient in vitamins, then definitely take them. That's not what we're not saying don't do that. But taking vitamin D when you have enough vitamin D is not going to sort out your estrogen deficiency. The only thing that's going to sort out your estrogen deficiency is taking estrogen.
Which brings us on to HRT. So for me, when I went to the doctor with my periods being very erratic, very heavy bleeding, very painful bleeding, and weight gain, as well as anxiety, as well as night sweats, as well as peeing every 2 seconds in the night, and the flushes throughout the day, he did my bloods, and this was after going private, by the way. This isn't my my local GP. And he told me that I had too much estrogen in my body. I was producing too much estrogen. So he said I had 0 progesterone, which was why I wasn't having periods, and they were all very erratic. And so he put me on, and we had this conversation last week about the difference between the body and the bio. And if you haven't seen it, go and have a look at it, because it was an eye-opener to me when Naomi explained to me the difference. He put me on Bioidentical progesterone cream. And actually, I know it's not a registered product. and it's not recognized by the Menopause Society, but it actually worked for me in that moment. So those sort of couple of years I was taking it, my periods came back. I mean, still they were very erratic. I've got endometriosis and adenomyosis, which is a whole nother episode that we were going to cover as well. I told you, this female health is not just we're just going to get it all done in 30 minutes. There's a lot of stuff, there's a lot of stuff we need to cover. So I got my periods, albeit rather erratic. I lost weight, which was one of the things that I did want to happen. I didn't feel like myself. I just was big everywhere. I was bloated everywhere, and I didn't feel like myself. I was very angry, very snappy at him upstairs. And actually the progesterone did sort me out. It really did. But slowly but surely the flushes came back and my periods stopped again. And I realized that it perhaps wasn't the right medication. So you and I have since picked up, and my treatment has changed. Yes. So I guess with hormones, with HRT, it is something that constantly needs to be checked, tweaked, moved, changed around. I don't know. Is it
the perimenopause? The difficulty is that the perimenopause is such a turbulent time in terms of hormones, and so you are chasing a moving target, and that's why it can be tricky to settle on a regime that's absolutely perfect, and why some women who find a regime that suits them in the perimenopause, then a couple of years later it's not enough, or it doesn't work, or they find that they need something else, because your own hormone production continues during the perimenopause. It just comes in fits and starts, and then as you head into the postmenopause, the hormone production ends, and actually after that point it tends to be easier to treat, because you're only dealing with the hormones that you're giving. You can control it, and you can kind of find an equilibrium. But typically the perimenopause is it's a hard, because hormones are constantly changing, and you can have side effects from giving them, and you can have effects of not having enough or giving too much, and yeah, it's tricky. But the message is that there are so many different products available. There's different ways of delivering estrogen. There's different ways of delivering progesterone. There's different ways of delivering testosterone, and different doses for all of them. And it's just a matter of trying, giving it enough time to see if it works. And then...
That's directed at me, by the way, everyone, because...
I did not say a word.
Because I got some new hormones last Wednesday. Look at this little gadget. And I was convinced that after 2 days, I was like, my flushes are still there. I'm still waking up, and I'm stripped off in the middle of the night, and my pajamas are on the floor, and it's like I've had a battle with my sheets, and the pillows are everywhere. And George is like, what is going on? It's like construction in the night of the bed. It's just like, you wake up and it's like, and I'm
cursing my name.
And I was like, that bloody stuff hasn't worked. But I think I just expected it to just, I don't know, take effect sooner. But when I think back to the cream with the bio, it did take about 6 months for everything to kind of come back to an even keel, so it's I guess it's like we just have to be patient and trust the process.
And what could have happened then is it could have just been that your own ovaries just kind of kick-started and pumped out some more estrogen, and that you then were riding those peaks and troughs, and that the progesterone may have been a complete red herring, or that you've converted other hormones or the progesterone into the estrogen that you've then utilized. So it's a minefield.
It's a minefield, and it's really complicated. For me, it just, as there's so much of it that doesn't make sense, and I like to think I'm quite logical in that way, and I like to go, oh, that makes that happen, and that. But I guess it's like you said, it's a moving target, and the hormones are fluctuating throughout the month, and it is a trial and error situation. And being able to have a relationship with your doctor to say, by the way, do I need to increase it, or by the way, this isn't working. It isn't working.
And as a doctor, And as a doctor, it's about kind of managing expectations as well. So I often say that to patients. So my patients tend to be more complex than patients that you would get direct, straight off the street as a GP. And I try and manage their expectations and say, look, you tend to get a gauge about who is going to be very straightforward, and who can, who's going to have one prescription and they're going to be sent on their merry way, and who's going to need tweaking, adjusting, coming back, making changes. And it is just managing that expectation that you're probably not going to get there overnight, but you're kind of in for the long game. And normally it's, we do get there in the end.
Okay. All right. So let's talk about our options then, as far as the estrogen goes. Estrogen, estrogen.
Estrogen if you're English, and estrogen if you are American. And I don't know what they say in Australia, and I don't know how they say it there.
Go on, try. Go on, give me a go.
No. I'm not going there. I don't know. Yeah, but I say estrogen. But you can say what you like.
I say estrogen.
Okay.
I'm going to get my arm out to show you my new estrogen pump, so you said to me you've got the option, you can either have a gel or you can have this. Now, after using creams
or the patch or patches.
Or the patch. Okay. Oh yes, the patch for me just doesn't make sense, because I like my baths and my lotions and my potions, and I just have a feeling that wouldn't stay on me. But then I might be wrong. And then I thought maybe if you've got more of an oily skin, again, that might not stay on. So the patch to me just seems like I'd have to be like, oh, is my patch on? Is my patch on? How long does it have to stay on for? Is it a week or 5 days, or?
You change the patches twice a week.
Right. Oh, okay. Okay.
Every 3 or 4 days. Yeah. Yeah. And
but that
you're
does...
absolutely right. Some women, they do have that I think it's just that slightly oilier skin, and they sometimes do just fall off, or they come off in the bath, or they come off when they're swimming, or they roll up. And others find it really hard to take them off, and they have the opposite problem where it's really painful. Someone described it as worse than waxing today. So it just depends. Skin type varies, hugely, and patient preference varies hugely. So
yeah, I guess if you're really, if maybe you're a little bit forgetful, then that might be a good way of having your hormones.
Yeah,
especially like
if you've got a coil, if you've got a Mirena coil, or you've had a hysterectomy and you're not got to worry about taking progesterone, it's easy because you just change it twice a week. Bob's your uncle.
Well, you've just got me onto the coil. I've just got this coil question. Shall we tackle this coil question then quickly? Because you just mentioned it. So this is from a lady who said she's 54. She started Everol. Is that estrogen?
Everol. It depends which one. It's always estrogen, but some of them have progesterone as well.
Well, I don't think this one does, because she said she takes Everol 50 patches a couple of years ago, and she's also got the Mirena coil. So that must be the progesterone from the Mirena and the estrogen from the patch, right? I'm learning.
You're doing good.
Her hot flashes have stopped, which is good, but her breasts are tender. Ugh, really tender breasts. And she doesn't want to get out of bed in the morning, and her anxiety is sky high. Her doctor has increased the patches to 75, but the only difference is that her breasts have gotten even more painful. And she hasn't got that amazing feeling that other people have had on HRT. So she hasn't got that really good reaction. I mean, I guess it's really hard for you to kind of prescribe what you think, but my instinct would be, and this is just from learning from you, I probably shouldn't say it, should I? Because I've got no right to say it. I've literally got no training whatsoever. but it might be testosterone.
That's a bit of a curveball.
Okay. Just pretend I didn't say that. We're going to tackle testosterone next week. But when she says she can't get out of bed, that low energy,
that bit absolutely. Yeah, I was thinking more about the breast tenderness. And breast tenderness is a side effect of taking HRT, and it can be an estrogen side effect or a progesterone side effect. But in the case of somebody just taking the patches with a coil, it's more likely to be an estrogen side effect. It often settles. It really does, if you give it some time, as in proper time, like weeks or even like 6 weeks or 8 weeks, then it can settle. And it doesn't mean anything bad. It doesn't mean that you're much more likely to get breast cancer, but it really can settle. And there is things like starflower oil with GLA that can really help. So there are things that you can take that will help. So if you're getting the benefits from the estrogen, then I mean, of course, you weigh it all up depending on how you are feeling individually. But if you can persevere, it often settles. But with the getting out of bed, yes, I mean, it could easily be a testosterone conversation.
But then equally, if the estrogen's if she's upped the estrogen, that, I mean, she hasn't said anything about the night sweats or anything, because my instinct would be like, if you haven't slept very well, that's when I can't get out of bed the next morning, because my sleep has been so restless because I've been fighting with the pillow and my temperature control.
Yeah.
So, but I guess definitely go back to her doctor, or just,
yeah.
I don't want to say your name, but you know who you are if you're watching. Maybe contact
just give
Naomi.
it a bit of time.
Okay. So we're speaking options of, so we've done the patch, we haven't actually spoke about these in detail. So this little thing is great because it's like,
just going back to the patch though. Sorry, before we move on.
Yeah.
Should I show one?
Oh please, yes, I've never seen one.
So that's a patch with a foil backing. And you can get some even smaller than this. I've only got one hand at the moment because the other is holding up Peanut. But you can peel off the foil, and then you just stick it on to bottom or thigh, or your upper leg. You can fit them underneath a bikini, so they can be quite discreet. One of the downsides to them, though, when you were just thinking about you coming on to the spray, to the Lenzetto, is that when you go for a patch, you kind of commit to a dose. So this, for example, is a 75 microgram patch, and once you've got that, unless you start chopping them up, then you've got your prescription, you've got your box, and it's harder to change it. Whereas with the so it's good for people who are settled or who you think are going to be predictable, but for people who you think might be less predictable, then the spray and the gel can be better for adjusting, because you can go up or down, or up and down.
That's amazing. Actually, I didn't even think about that. Of course, it's just going to give you that dose, that one dose, unless you say you start cutting them in half or in quarters, and then you're like,
and then it becomes just a bit trickier. You don't quite know what you're getting, and I mean, it's possible, but it's just something to consider when you're making a decision.
What do they start at? Is 50 the lowest that they start at, or is it even lower?
They come lower. They start at 25,
okay.
But a 50 would be a kind of good going starting dose. 25 would be a low starting dose, and it would depend on the patient's situation as to what you would start with.
Okay. I'm just eager to talk about this little
gadget. You go for it.
No, so this says it's called estradiol on this.
Yes, that's the hormone.
So this is the estradiol for my lack of estrogen in my body. And the idea is that this is going to lessen my flushes, which actually, if I'm honest, I've had one today. I've had one, which is pretty bloody good going.
How many do you normally have?
Probably about 7.
Right.
So actually yes, and considering I had a massive sugar attack today, where I just literally ate everything that had any sort of bad sugar in it from the cupboard, and usually that impacts it. And I've had coffee, which we know also impacts the anxiety, and so that is really good. Good going. So actually that's a big step in the right direction. And last night's sleep wasn't too bad either. So I mean, in my head I wanted to come today and be like, this is amazing, it's changed my life, and I guess it has. I just doing slowly, baby steps, rather than just being like an overnight success, and just obviously get the dosage right. So I'm doing 2 pumps of this. I'm doing one in the morning, one in the evening, and what I really like about it is it's so quick and easy. So where I usually used to have to do the cream and do like this, or get the cream and do it here, or doing the top of my toes, there's different areas, and you have to sort of alternate it, don't you? Or at least you're advised to, especially with testosterone we'll do next week, but with that estrogen, is that right? With the progesterone and estrogen, you
with the gel. So with the estrogel, it doesn't really matter actually. You can put it on your upper outer arms, on your thighs, on your tops of your legs, bottom, anywhere like that is absolutely fine. Testosterone, it's more important to rotate your application site because you can get some localized hair growth, so which you want to avoid. But
yeah.
with the estrogen, it tends to be, there tends to be enough of it that forces you to spread it out anyway.
Okay, but with this one, it's just like this, and I just literally put it on my forearm there. I'm gonna do one little pump. Did I do that right?
I missed it. You went. I'm sure you did. You went a bit fuzzy, but yes, yes, perfect.
It's on there, and it's a little damp circle, and then I just let it dry, and it's done.
Yeah.
Doesn't really smell of anything. And it's really quick and easy. So I guess I could do that there. I mean, in the booklet it says this area. Obviously I don't want to put it anywhere near my breasts.
No, yeah. That's the most important thing. Yeah.
So nowhere near with naked skin, and then it to go closer to my boobs. So we want to avoid that.
Yeah, and your inner thighs, another place that you can use it, but because it's quite a small area, even if you're on lots of sprays, you've got plenty of there's plenty of space to spread it out. And
this is relatively affordable. This was a, how much was this one? Do you remember?
Is it about £20? Was it about £20?
Yeah, which is massively reasonable.
It depends on how much you're using. So if you were going up to 4 or 5, to multiple sprays, then of course you're going to get through it faster and you're going to use more per month. But it's not prohibitively expensive to a lot of people. And also it is starting to become available on the NHS. It just tends to be a question of asking. And some people are now starting to prescribe
you can suggest this one, Lenzetto, when you do go. See, the thing is, what we want is for you to be armed with information and knowledge, so when you do go and see your GP and he's like, or she's like, you can be like, actually, I want to take the Lenzetto, the estradiol spray, or I want to take what's the gel called?
The gel that I like is Oestrogen, which is that it comes in a container which you can recycle, and you push the top down and it gives you a little blob of gel, and it measures exactly what you need, and then you can go from 1 pump, 2 pump, 3 pumps, 4 pumps, and then you rub it in just like we discussed. You kind of rub it in, and it just dries in the same way. And so the important thing with these two products is that you let it dry and you don't get it wet or cover it with sun cream or let it rub off onto clothes or small children or pets or things. It just needs that time on your skin to be absorbed.
So if you were to put the gel onto your arm, would you then have to wash your hands?
Yeah, people do wash their hands afterwards. I think it's not really important for you, but it's more important for contamination. So if you're going to go and, I don't know, make your pet's dinner or something, then you don't really want them getting a day. I don't know, I'm a bit pet focused at the moment.
You just live with animals. That's all. You haven't got like loads of kids. You've got 5 kids. Have you got 5 kids?
Yeah.
5 kids and Peanut. But she just cares about Peanut right now because he's had surgery. Peanut's the dog on Naomi's lap, if you're just tuning in. Okay, cool. So the price for the gel, what are we talking there? Is it very similar to this? And is it available on the NHS?
It is definitely available on the NHS. There is no reason why you should not have it on the NHS. It is cheap. It's between about £9 and £12 for a bottle, which is actually comparable to the Lenzetto because the Lenzetto is more concentrated. So they're really very similar in price, and yeah, I mean it's not massively expensive, and if you compare it to prescription charge, it doesn't really make a huge difference whether you have that privately or on the NHS. But I have heard of a few people this week whose GPs didn't think that they were allowed to prescribe it, which you just kind of think is utter madness. And there's no argument for cost. Somebody else said, is it because antidepressants are cheaper? No, antidepressants are not, or a lot of antidepressants are not cheaper than giving estradiol. So it doesn't really make sense, even as a kind of economical argument. But yeah, it's not expensive stuff.
Okay, so we just need to keep pushing for what we want, and like I said, just arm ourselves with the knowledge that these products are there and that we have the options to take them, and actually they're not that expensive in the scheme of things. I don't think you can put a price on feeling like yourself again, for getting your mental health back, for getting your, you know, your, like you say, the joie de vivre, that energy, that your weight, you know, to get your weight down, to stop the night sweats, the flushes, the anxiety, for all these things that come to us at a time when we've worked so hard in our lives to, you know, we've got to the place where we're in really good jobs, and all of a sudden you just think, oh, I can't do this job anymore. So I don't think you can put a price on getting that back, getting your life back.
No.
So
but it's not even like you have, you know, it's not even like you've got to pay a huge amount of money, you know. It's either, it should be just a prescription charge, and there is a slight bugbear that you have to pay an estrogen prescription charge and a progesterone prescription charge, even when the product is mixed together. But which again is just another HRT madness. But it isn't, in terms of getting your life back, then it isn't a huge cost. It's not like, you know, a weekend at a spa or something like that, that, you know, you could equate to some me time.
No, I was just thinking about the cost of antidepressants and all of that, you know, like just just the comparison of it all, it just doesn't make sense to me. There's like 50% of the population is women. Like, why isn't there more help and care and education and money that goes into this? I just don't get it. I just don't get it. It just really upsets me that we have to suffer like this, or we've had to. Thank God people like you are out there and that we're talking about it.
And you, though, I mean, it's amazing that you're using your platform to you know,
to talk about my night sweats.
No, but also your honesty. You know, it's, you know, it's quite a big thing to get up in front of people and admit, you know, health concerns, isn't it? Particularly very personal health concerns, and yet when you do, it then opens it up, you know, opens the conversation up to everybody to say, well, actually, that's, you know, that's what I'm going through too, and then hopefully, you know, encourage them to go and get help.
I wanted to talk to you about a symptom that we didn't really talk too much about, but was mentioned in this message to us. And I know that there's more topical creams that work on this area. So vaginal dryness and urine infections, that is also a massive side effect of perimenopause and menopause, isn't it?
Yeah, it really is. And it's often overlooked. So a patient might not tell you about it in a consultation, and a doctor might not ask. And it can be, you know, it can be hugely debilitating. So yeah, really painful. Painful intercourse, recurrent infections, recurrent urinary infections, bladder leakage, and it's actually fairly easy to treat.
And I guess initially, because us women have had to deal with cystitis and thrush and things like that throughout our lives, you would sort of like go and self-medicate and go and buy some Canesten or go and buy some Cystex or whatever it is and try and treat it that way. So you're taking all this stuff that actually isn't curing the root of the issue.
No. Yeah, absolutely. And you see women who have, you know, infection after infection after infection after infection, and they can go off and be investigated and have, you know, all sorts of very invasive, not very pleasant investigations, when actually they just some local estrogen, which very few people can't take, very few people can't take, and it can just be a total game changer.
And that's in the form of pessaries or just cream?
Pessaries or creams or both. Yeah, there's a number of different products on the market, and you can try different ones. You know, it's they all do a similar job, and it can be, yeah, just totally life transforming. And you can use them in addition to HRT, or you can use them on their own. And if you use them on their own, you don't even need to take progesterone as well. So, and some women really like that, especially if they're progesterone sensitive, and that's where they've got the, you know, the majority of their symptoms. Then you can take it really safely. And there is, just as a kind of point on that, there's an information leaflet that comes in the box and packets of them, which if you read it normally scares the life out of everybody, because it's based on taking oral estrogen, and it tells you about taking it for as little time as possible and as low a dose as possible, and how it gives you breast cancer and heart disease and all that kind of thing. And actually they don't. They're very, very safe, and it's really important that if you do suffer, that you continue to take it, because as soon as, it's a bit like watering a flower bed, you know, when you have a very dry flower bed, you want to give it loads of water to kind of make it spring back into life, but if you stop watering it, it's going to dry up. So you just need to keep giving it just little kind of top-ups of medication or water, and then it just carries on thriving.
And is that going to increase the collagen in that area as well? Is that what it sort of does, the estrogen, so that then you do get less irritation inside and more lubrication naturally, so that you can continue to have a healthy sex life? And
it re-estrogenizes the whole tissue, so all of the tissues through that your whole urogenital tract really need estrogen to function properly. So in terms of muscle integrity, in terms of collagen, in terms of the lining, what we call the epithelium, the bacteria the good bacteria that coat the inside of the vagina, all of those things need estrogen, and without it, it essentially just doesn't work properly, and the pH changes, and bad bacteria can get in, and things thin and sag, and basically just don't function in the same way as they should, and that's where you get problems, and you just re-estrogenize it, and it tends to.
These bloody hormones, I tell you, are responsible for so much. It's just unbelievable.
It's a phenomenal hormone, though, isn't it? It really is amazing. It's
so. I mean, yeah. Okay, so what about progesterone then? So we need that too. Because now I'm not only on the estrogen, but I'm also on the Utrogestin. Is that the pill that I take at night? I said it right, the Utrogestin pill. And I'm on that continuously without any kind of break at this moment in time. So talk to me about the estrogen and the progesterone, and how we know that needs to both be incorporated as a topical oral HRT.
So if you have a uterus, then you need to take progesterone if you're taking estrogen HRT. And the way I explain it to patients is that the lining of your womb, which is called the endometrium, is a bit like a lawn. And if you pour in estrogen onto it, it's a bit like giving it sunlight and water and fertilizer, and that lawn is going to grow. And what the progesterone is effectively the lawn mower. So it keeps your endometrium in check, in the right, being the right thickness, and not overgrowing. Without the progesterone, then you can end up with an overgrowth. With the progesterone, it keeps nice, and basically we want it nice and thin and kind of sorted. When you're in the perimenopause, so if you're still having periods, then it's important to use a preparation of the progesterone as a cycle. Otherwise, you're going to end up with annoying, erratic bleeding that can end up with you being investigated unnecessarily. And also, it's just really annoying. So you give it as a cycle. So you have a kind of thick and shed cycle, effectively. Once you have been on HRT for a while, or if you are postmenopausal, then you can switch to a continuous progesterone. It's basically taking a small amount of your lawnmower every single day. Keeps it nice and check, and it keeps your hormones more stable, because some women are sensitive to that fluctuation in progesterone, and it can just sometimes just keep you on a bit more of an even keel. And that is the Utrogestan, which is the body-identical micronized progesterone.
And that's what I'm on, but I haven't got a pack here. Have you got a pack there?
No.
Oh, damn it. I did have some. Shall I go get it? No, it's a little box.
No.
And it's I'll post a picture on my page after. Okay, so follow-up question, Your Honour. I'm not going into the menopause just yet, but yeah, I'm on this continuation of Utrogestin, and that's because
because you've been on HRT for a while, then you can be considered. I mean, the whole thing about being perimenopausal, postmenopausal, it's about having your last. It's just about your last period. It doesn't really matter. So if you've had very few periods or no periods, then you have been on HRT for a while, then you can just go onto that continuous preparation, and in the hope that it stays, you stay bleed free. If bleeding becomes a problem, then you might have to think about going back onto a.
I have had a few cramps this week with this new thing. I'm not sure whether it's just something in my head thinking like, hang on a minute, I don't want a period. That's all I know. I definitely don't. I thought I used to, like a year ago, if you had asked me, do you still want a period? I would say, yes, I still want a period, because it feels like I'm releasing, and it just feels like what my body's supposed to do. It's so weird. As a woman, you're just so used to having periods all your life that when they stop, you sort of think, I still want them to continue. Most of my friends say no, they don't, but I was still at the sort of mindset that I just felt like it was quite cleansing, and that was my body was still doing what it was supposed to do. Not that I was trying to get pregnant or anything, but now if you ask me, do I want a period, it's been 6 months, I don't ever want a period again, because they became so painful, they became so heavy. I couldn't leave the house. Like I couldn't. It would just be like change of clothes, change of everything, and just absolutely awful.
And I think that the bleeds that you had about 6 months ago were when you started a new hormone. So they were probably not a period. So it's probably been longer that you. Do you see what I mean? That's so if you because bleeding is quite a common side effect for taking HRT, and you just started taking HRT and then you had a bleed, my assumption is that actually your last true period was much longer ago, and then you hadn't had a bleed having been off it. So that's the assumption.
Okay. And you're only technically into your menopause phase when you haven't had a period for a whole year. That is that.
But what a lot of women ask is, well, how do I know if I've got a Mirena coil or if I've been on HRT? Well, actually, you don't know. But it doesn't really matter. It really only matters if you are considering, if you're thinking about the rules with regards to contraception. But there's no other. You don't really otherwise need to know, because it's just really just this ding 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 ding, and then it just kind of flattens out.
Ding 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 ding. Let's keep that ding dings happy, because the ding 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 at the end, when we're like, we've got it sorted, we're feeling great, we've got our energy back. Oh my god, I could talk to you all night. We've had 30 questions, and I've never done this question thing before. Let me have a little look. Oh my god, there's so much.
I can't see them now.
I know. Can you see me?
I can see you, darling. Yes, but I can't see. I can't see any questions. Yeah.
That is a weird thing. I've never done it. So they come up in tiny little boxes, and there's loads and loads of questions. I'm going to turn the comments back. What's happening? Have you got somebody else coming?
Can I deliver Peanut out the room?
Yeah. Give Peanut needs. It's fine.
Do you want to take him?
Peanut's made an appearance tonight. Everybody's seen him. We all know that he's okay. So I'm going to turn the comments back on, guys. I'm sorry I can't get to all those questions, but I know. Hot and heavy. It's like a big dog, Peanut, isn't he?
He's solid.
Not
he's
relatively
big. He's big boned.
So
he's
cute.
not FAT. People call him FAT. He's not. He's just big boned.
Thank you, Kayla Fitness. She's saying great live. I mean, what we aim to do, whoopsie, is each week, because we don't want to rush everything, because there's so much information. But thank you for keep DMing us. Somebody's just saying, can you take HRT if you're on the pill?
You can if you can take HRT if you're on the progesterone only pill. Absolutely, definitely. You can use the combined pill, particularly some types of combined pill, as HRT. So there are a couple of particularly good brands of combined pill that make good HRT.
Okay.
Yeah.
Oh God, I can't see you, Naomi. I have to turn that off. I literally can't see you. It's so distracting. There's so many questions. I mean, the side effects of this, for example, if I were to just up the ante too quickly, which, let's be honest, I was tempted. I was like, it's not working. So I'm taking 2. And actually, this is a stronger dose than I was initially taking of the estrogen Bioidentical.
Yes.
So already I'm upping quite massively. So I was at 0.5, and this is...
You're using 2 of those, which is the equivalent to 4 pumps of gel. It's you're on a good dose. So
okay, I'm feeling
ish.
good. I'm feeling
everything's ish, because you absorb gel differently to how you would absorb a patch to how you would absorb a spray. Like, different women absorb different things in a different way. But we don't want to overcook you. It's just
what would happen? Lightheaded, nausea, and I mean, there's all sorts of side effects like that, isn't it? Really, or headaches, perhaps.
Yeah, breast tenderness, bleeding. You've had a history of endometriosis. You don't want. Just checking.
My boobs were fine.
So yeah, there's those kind of things that you just want to take it just a little bit slowly.
Okay, amazing. Is there anything else? I mean, obviously there's so much, but we just wanted to keep it estrogen.
Products wise, I think we've probably done it, haven't we? I got loads of DMs like this afternoon, which I haven't even had a chance to look at, so I do apologize for people who...
The coil, the Marina coil, because you did suggest that to me. So let's talk about getting the progesterone from that, actually, rather than taking the eugestrone.
Yes.
Yeah. So what would be the reasons for having the coil?
That is brilliant. Marina coil is brilliant if it suits you. The downside, so it basically provides the endometrial protection component of HRT. So it's your lawnmower, but it means that you haven't got to take anything every day or for half the month. It's just basically sat there mowing your lawn in situ without you even having to worry about it. But it also can help with bleeding. So if you have problems with heavy bleeding or erratic bleeding, it's brilliant at sorting that out. It can eliminate it or certainly make it much lighter. It's also an excellent contraceptive, so if you need contraceptive, then it is brilliant. So it works in all 3 ways. You've got to have it fitted, which some women women's perception of having it fitted is very, very different. Some women, it's just literally like, oh, it's in my diary, I'm going to pop and have that done tomorrow, whereas other women have very negative experiences of it. And so it depends on how that is for you. It is, but once it's fitted, it has a relatively low side effect or problems to do with it. If you're going to have a problem with it, the problems tend to be just immediately or soon after being fitted. And then if everything goes well, you can be sorted for 5 years. So there are a lot of
5 years, yeah. Really? And it just just slowly releases the hormone.
Tiny bits, yeah, every day, and it does work really well, but it's not for everyone, and some women just do not like the idea of it.
I kind of think I don't know how I feel about something alien being implanted into my body. I don't know. I feel like, I don't know. It sounds like something metal. When they say coil, it sounds like a metal coil.
I know it does. It's actually, they need to rebrand, don't they? They need to give it another name. They need to give it another name, because coil sounds horrible, actually. I hadn't really thought of it like that. But we should think of a name, shouldn't we? Yeah, one is not.
I don't know. Let's brainstorm.
Metal. The copper coil is copper, but the Marina coil is. I used to have one floating around.
I hope Peanut didn't get it.
Peanuts, I don't think, not today. But it's just like a little plastic. It's like, like a sycamore. Sycamore seed.
Yeah.
It looks a bit like a very, very small, very narrow sycamore seed.
Okay.
Made of plastic.
That doesn't sound offensive or dangerous or spiky at all, which is
It's not spiky. No.
Okay, all right, we need to rebrand that. You did say earlier about people being, some women being sensitive to progesterone. What can you do if you are? Does the Mirena kind of counteract that sensitivity? Because I mean, does it?
Sometimes, yeah,
Okay.
often, in fact, often. So taking oral Utrogestan can be a problem for some women, and it can give them horrible side effects. It can make them very, very anxious, very angry, very irritable. You know, it can have significant side effects. And if it does, then there are ways of getting around that. You can use the same Utrogestan vaginally. So rather than taking it orally, you use it vaginally. It is off license, and so should be under the care of your doctor. I don't think that women should start tinkering with their own medications without it being, under supervision. But that's one thing that you can do. You can adjust the dose regime, and you can really minimize the progesterone as long as you're having regular scanning and surveillance. And then that's the point that you kind of get a little bit more, you can get a little bit more stuck, but then you can try Mirena, and that is a good alternative. There are different progesterones that you can use. Normally the Utrogestan is the most friendly, but in some instances just trying a different progesterone can make a difference.
Okay, so don't just write it off completely. Maybe just look at the other options and see.
Yeah.
Yeah.
Definitely not. That goes with any HRT really, is that please don't, just because one's not suited, don't just dismiss it completely, because there are so many different preparations, there's different routes, there's different doses, and if it's something that you really want to try and you feel that you're kind of coming up against a brick wall and it might not suit you, then there's alternatives.
Okay. Amazing. And be patient when you do get the medication. Take time, be kind to yourself, and just realize that everything just needs to settle again, and it will eventually even out.
It's slowly, and because the danger is that if you rush into it and you go for whack and great doses really early on because you're desperate to get going, you're more likely to end up with side effects and a negative experience.
Okay, amazing. Thank you so much. Let's do it again next week, which means I'll be 2 weeks into this, and I will probably have had a completely night flushing, night sweat free sleep. I don't know what I was trying to say, but you know what I was trying to say. And less brain fog, Meno moments. So to be continued.
Less Meno madness.
Yeah.
Meno sanity.
The madness of the menopause will hopefully not continue, but we will continue next week. We're going to bring it back. We're going to tackle testosterone because it is something that is massively important for some of us girls, and it's one that needs a little bit more sensitivity and a little bit more time. So we're going to dedicate next week's episode to testosterone. So let's bring it back next week. In the meantime, thank you so much, Naomi.
Thanks for having me.
Dr. Potter, we'll see you now. Thanks everybody for watching. And again, like, any questions?
My cheeks hurt.
Did they? From smiling. I know, it's nice to have a little bit of humour in amongst the seriousness of the subject. So, but thank you so much again. Just amazing information. You explain it really, really well. And let's all start feeling good and feeling empowered that we know the route we want to go down and the decision that we want to take. And again, you don't have to do the HRT. There are lots of foods that are rich in phytoestrogen and things like that, so you can research it, can't you? But we will be tackling natural remedies as well a little bit later on in the weeks coming. But in the meantime, have a gorgeous night, everybody. Naomi, love your work. Love to Peanut.
Thanks for having me. I will. Yeah. Little Peanut. Thank you.
Lots of love,
See you
everyone.
later.
Night. Bye.
Bye.
Oh, I can't get off.
No, me neither.